So I thought today we might talk about cancer, because cancer is obviously very common. We see a lot of women, don't we, in our clinic, women who have had cancer for various reasons, and often women are told that they can't have HRT. And although HRT is only one type of treatment for the menopause, it's really important, especially for younger women. And as you know, women up to the age of 51 really should have hormones if they can, but a lot of women out there are still being told they can't. So I really wanted to do this discussion so we could hopefully educate a few people what they can ask their GP for if they've been told maybe in the past they can't have HRT, so they can reflect. And we've just launched a booklet today, which I'm sure you've all seen, have you? Called Menopause and Cancer. So it's available as a PDF in the resources section of both websites. Really just as a focal point really for people to start talking. So should we just talk, maybe, Alice, do you want to talk about what type of cancers really women can be reassured if they've had cancer in the past, how it can...
Yes, I think women have to be reassured that really the only cancers that have to be given special consideration are hormone-dependent cancers, which have to be given special thought. And particularly we're talking here really about one type of ovarian cancer, which is the endometrioid cancer.
Which not that's not that common,
rare,
is it?
Very rare. Yeah. And also some endometrial cancers, depends on the staging and how advanced the cancer is when the woman has a diagnosis.
So that's cancer, the lining of the womb, isn't it?
The lining of the womb, which of course we talk to most women about when we're discussing HRT, because as most women know, you have to have protection for the lining of your womb if you are receiving estrogen, because it can cause the lining to overgrow. So in those women we have to give special thought to what the staging was, and we would want to liaise with their gynaecologist to discuss that before even considering any hormone replacement therapy for them. But most other cancers, they can quite safely have HRT because those are not hormone dependent cancers and won't be stimulated by the estrogen that they're being given.
Yeah, so because Sarah, just explain for people out there, why is it so important for young women to have HRT, and why do many women who've had a gynae cancer go into menopause early?
There's lots of reasons why younger women can reach even more problems than if they've gone through to a natural age of menopause. Women that have had cancer may well have had their ovaries removed surgically, and also they may have had treatments such as chemotherapy or other drug therapies or even radiotherapy that actually damages their ovaries either temporarily or sometimes permanently. And so many of these women are quite young, and therefore they end up with a lot longer in front of them without hormones, and the damage then to their blood vessels, to their bones, to their brains. So they tend to have more problems with mental health issues, physical issues, and things like sexual dysfunction as well. So it's even more important that these younger women have access to the right kind of advice about whether HRT is appropriate or not.
Yeah, because it's very clear, isn't it, Rebecca, nice guidelines about women who are going to have a hysterectomy or ovaries removed should be spoken about before the surgery, shouldn't they?
This is the ideal, isn't it? And of course, sadly, that doesn't happen. People are so wrapped up with a cancer, understandably, that they focus on the treatment quite rightly. But sometimes that sort of, and by the way, there's an effect of this life-saving treatment and treatment you need is we're going to have to, I'm sorry, but there will be some damage to the ovaries. Which is maybe said, but it's pushed to one side because it's such a dreadful emotional time. And then it's only later we sort of realise, actually, gosh, the effects have happened, and dealing not only with the cancer, but then dealing with the menopause.
Well. And I think I've spoken to a lot of people, and they've been counselled about infertility, because we all know, our ovaries are really important, produce our eggs. And so young women, obviously, and it's very important that they have the conversation whether they need their eggs freezing. And for a lot of younger women, they don't know about the menopause, so they think, well, my periods are going to stop, that's okay. But they don't realise the big impact of symptoms, but also, like you say, for our future health. So women who have an early menopause have this increased risk of heart disease, osteoporosis.
It's vital.
Absolutely. So it's really important, more important, isn't it, than even women in their 50s considering HRT. It has to be seen as a replacement.
And quite a lot of women in retrospect end up saying, well, actually the cancer and the treatment for that was relatively simple compared to how I now feel, which is dreadful because I'm now menopausal, and I had no idea that was coming.
Really hit me hard. And the other thing is actually recognising the symptoms, because of course, you know, they've been through dreadful treatments, they've had a life-changing disease, illness. Naturally, they're perhaps going to feel a bit low and flat and exhausted. Yes. And then people say, they say themselves, well, it's the chemotherapy, I'm going to feel tired after that, or I've had radiotherapy, I'm tired. I'm naturally going to feel low and anxious and not sleep because thoughts go around my head about, have I been cured? And of course, yes, that can happen due to their illness, but a lot of that is, and probably most of it is due to the menopause causing those symptoms, which they don't realise. That's right. Yeah. And so that's why the diagnosis of the menopause, actually, although it seems fairly obvious, can take many years because they don't recognise their symptoms.
And it's the surgical menopause is quite harsh, isn't it, compared to a sort of natural menopause where our ovarian function just declines.
So in most women who undergo a natural menopause, there's a natural decline of the hormones, which is quite gradual as the ovaries start to fail. So we're born with a set number of eggs in our ovaries, and we're genetically pre-programmed for them to fail, on average around 50-51. In women who have their ovaries removed, that's it, it's gone, it's all gone. You know, the 50% of estrogen that's produced, all gone straight away, and you go into a very, very rapid decline in hormones, which precipitates really quite severe symptoms.
Some women can have symptoms even with hours from waking up from their surgery, can't they, if they're having their ovaries removed? So
I think it's particularly vital that those women who are undergoing a surgical menopause have counselling when they have their pre-operative counselling. So we talk about how long the surgery will take, the risks of the anaesthetic, but they really need to know that actually they're going to have no hormones, and in an ideal circumstance actually be provided with some hormone replacement when they leave hospital. And if not, write it in the GP discharge letter so that, and tell the lady, please go and see your GP in 2 weeks' time to have that proactive conversation to take charge of that. Because by then they'll have recovered from the surgery, they'll be aware of the fact that actually they've got ongoing symptoms that are not attributable to their surgery, and they can get early treatment, because the earlier they get treatment, the better the long-term outcome is for them.
Yeah, it's really important, isn't it? And so when we talk about HRT, it's just 3 letters, as we know, and you say quite rightly about estrogen. So estrogen is the most important part of HRT, isn't it? But there's another hormone, isn't there, testosterone, which is really important, especially in younger women, and especially women who have had their ovaries removed. So do you want to maybe say a few words about testosterone?
So testosterone, we tend to think of it as a male hormone, but actually we know that we actually make 3 times as much testosterone as estrogen. And
she's 3 times as much. It's a huge amount. I don't know, were you ever taught this at medical school?
No, not
Did anyone say to you, Alison?
No.
It's amazing, isn't it? It's the most probably, it is more probably, is it more important than estrogen? Don't know, but we produce more of it. And then it goes without our ovaries, or a lot of it does.
So it starts to decline gradually in our 30s, but if you have your ovaries removed, then it suddenly drops down very low, and that has a big impact on libido, which if you're a young woman experiencing a menopause, then libido is still an extremely important part of most women's lives, but also it's about how our brains function and how our mental focus is, and our concentration and energy, and a sort of physical and mental stamina as well. So actually that can make a big difference to replace that as well, and a lot of people just don't realise that's even an option.
No, because they used to have this testosterone patch, didn't they, that was available, and it was actually licensed for young women who had a surgical menopause, so very clear indications, and now that's not licensed, we don't have that anymore, and so actually I think it's really sad that women can't easily access a hormone to replace what's missing in their bodies, and
exactly.
It's not right, is it? Because
it's
it can make
right.
a big difference.
Men obviously can have hormones, and they can access testosterone, Viagra for for sexual dysfunction.
Yes.
But it's interesting is that women aren't able to access testosterone, even though they've had a reason for decline, a menopause or a surgical menopause.
Absolutely, and I think although we're talking about the patients, for the partners, it's really important that they have information too, because when their partner is changing in front of them, and as we know, because we've all become through the menopause, it's quite isolating and scaring as well, isn't it? You don't know what's happening, and because, like you say, the cancer treatment is very consuming, you're seeing lots of doctors, you're getting lots of attention, suddenly that stops. That's quite soon, usually after chemotherapy or after surgery or radiotherapy, and then the couple are often on their own, and they're thinking it's all the emotional sort of journey really from the cancer, don't realise it's the menopause, and then they're not having, reduced libido, they might have symptoms such as vaginal dryness, soreness, so they're not having any intimate relationship, and that's quite hard then to talk about. And I don't know about you, but I've certainly seen a lot of patients who've told me that they've explained some of these symptoms to their doctor, and their doctor said, well, you haven't got cancer, it's not come back, so why are you worrying? And it doesn't matter. Of course it matters. And actually most women, thankfully, who've had cancer will live a lot longer without cancer than, with their cancer or before their cancer even, wouldn't they?
Yes, exactly. It's the rest of their life really they've got to start thinking about, and the physical side of their relationship's incredibly important.
Yeah.
I think that's where we're good as generalists, because we're so used to looking at holistic well-being, aren't we? And like you say, the women are largely going to survive. We've got much better treatment for cancer now.
Yes.
So most women are surviving, but they're not surviving well as we perceive wellness if they have all these symptoms that are unaddressed.
So I think there's some really key messages for women is that firstly they need to seek the right information for them. We're all individuals, they've all had different cancers, different stories, but they need to get the right help, and sadly there aren't many menopause specialists, but they need to keep looking and researching. Most women can have hormones. Even women who've had breast cancer can still use local estrogen very safely, can't they? So that's a vaginal pessary or a ring or cream. And there are other non-hormonal treatments that are possible both systemically and internally. But I think the big message is if women are young, then they really need to consider HRT, because more women will be able to have it
future
than
health
most.
is so important. Yeah.
So great, that's been really good. Thank you ever so much for talking about that. Thank you.